Hello, my name is Samantha Costantino and today I will present to you my topic chronic obstructive pulmonary disease, also known as COPD. I will provide you with a brief description, some statistical information, and finally I will discuss the IPE team involved in the diagnosis and treatment of COPD. COPD is a combination of several different but related diseases, principally chronic bronchitis and emphysema, which are primarily characterised by difficulty in breathing. Tobacco smoking is regarded as being the highest risk factor in the development of COPD and has demonstrated to be responsible for 75 to 85% of cases. Other contributions to the development of COPD include indoor pollution due to poor ventilation with the use of biomass fuels for cooking and heating, as well as exposure to occupational fumes and dust. In Australia, COPD was reported in 2007 to be the underlying cause of 4% of all deaths, with percentage of associated deaths projected to increase worldwide. In Indigenous West Australians, where there is a high smoking prevalence, the mortality rate was 4.5 times the rate of non-Indigenous West Australians in 2006. It is more commonly diagnosed in men than women worldwide. Overall management of COPD is best managed through a model accessing a multidisciplinary team. The initial diagnosis and case management is managed through the general practitioner. They are responsible for coordination of team care arrangements through a COPD action plan, specialist referrals, and ongoing assessment and treatment of the disease. The practice nurse is integral in monitoring and surveillance, may be qualified in conducting spirometry testing, and can provide additional information to the GP regarding how the patient is coping with the disease. The respiratory specialist is able to establish the diagnosis by excluding other pathology, is able to assess treatment appropriate to severe COPD, and can treat the patient in hospital during exacerbations. The respiratory physiotherapist provides pulmonary rehabilitation, can plan group or individual supervised exercise training, and provide relaxation strategies to assist management of anxiety to cope with dyspnea, which is a sudden and severe shortness of breath. Dietitians are able to assess weight status and determine energy needs throughout different stages of the disease. The role of the psychologist is to assist in the management of depression and anxiety, which often occurs in people experiencing chronic disease. They are also able to provide relaxation strategies. In conclusion, COPD is a largely preventable and treatable disease which is increasing in prevalence worldwide. Public education is essential to reduce take-up of smoking and therefore assist in prevention of the disease. A coordinated multidisciplinary team approach in the care and management is considered best practice in managing symptoms, improving quality of life, reducing hospitalisations, and maintaining patient independence at home. Thank you for listening.